Good afternoon to you all, ladies and gentlemen. Today's exciting. We are going to discuss what I regard as one of the most important vitamins. They're all important, don't get me wrong, but this one takes the cake, vitamin B12. We're going to spend 2 short videos on vitamin B12 and learn all about the implications of a vitamin B12 deficiency and why this vitamin is so important for our well-being. So stay tuned and let's start the journey. So as you can see in this slide, vitamin B12 is also known as cyanocobalamin. All right, that has to do with the chemical structure of the vitamin B12 molecule, but you will hear them called the cobalamines, cyanocobalamines, vitamin B12. They're used interchangeably. Now, this is important. Vitamin B12 is actually synthesized by bacteria and exists in all animal foods. We must ingest vitamin B12, all right? When we ingest animal foods that have vitamin B12 in them, the B12 is freed through a process called proteolysis in the stomach, and it requires stomach acid to do this. The stomach also secretes something called intrinsic factor, which is necessary for the absorption of vitamin B12 through the large intestine. Now, this is very important, ladies and gentlemen, because with the constant use in our society of antacid medication and proton pump inhibitors, we decrease the amount of acid available in the stomach to free our vitamin B12. This also decreases intrinsic factor so that vitamin B12 cannot be absorbed. And many people have B12 deficiencies. B12 is used by all DNA synthesizing cells to facilitate the metabolism of folic acid. Now, do you remember way back when we talked about a cardiac risk factor called homocysteine? And homocysteine is an intermediary in the metabolism of methionine. And when it accumulates, you get heart disease. And the reason it accumulates, the most common reason, is a lack of vitamin B12, folic acid, and vitamin B6. And you give patients these 3 cofactors in the chemical reactions, and you find that their homocysteine levels drop. So we say that B12 is a methyl donor group. That's how B12 works in these chemical reactions. It donates a group known as a methyl group to homocysteine to get it through the critical chemical reactions. B12 is also critical to the hematopoietic system. That is the system that forms blood cells. And if you have a B12 deficiency, you're said to have a megaloblastic anemia. Megaloblastic just describes the shape of the cell. If you have an intrinsic factor deficiency, whether it's congenital, genetic, or it's due to high antacid intake, you have what's known as pernicious anemia. You may have heard those terms. They all have to do with vitamin B12. Now, vitamin B12 also plays a vital role in nervous system function. All right? It is important in the synthesis of our neurotransmitters. These are the chemicals in the brain which convey mood, excitement, inhibitory actions. So if you don't have enough vitamin B12 and you're not synthesizing the proper neurotransmitters, you may end up with a mood imbalance. They maintain the glial cells in the nervous system. These are the cells for communication. And you know what? Without B12, here's our old friend homocysteine. It accumulates in these glial cells and causes neurotoxicity, or toxic chemical reactions, and then these can lead to memory loss, dementia, perhaps Alzheimer's disease. All right, we're going to stop here, and when we pick it up next time, we'll talk about B12 being a product of bacterial metabolism. Again, this is very important stuff. Go over this several times. And you will learn to appreciate the role that B12 plays in your metabolism.